We all think teamwork in a hospital is crucial, right? I mean, it seems obvious. But what if I told you that for years, scientists couldn't actually prove it? It sounds crazy, but the evidence was, well, fuzzy at best. Today, though, we're diving into a landmark study that finally gives us the hard data, connecting the dots between great teamwork and patient outcomes.
All right, so here's how we're going to break this down. First, we'll look at why the picture was so confusing to begin with. Then, we'll get super clear on what teamwork even is. After that, we'll see how they did this study of studies, what the clear answer was, and a really surprising twist they found. And of course, we'll wrap up with why all of this really matters. Okay, so first up, the confusing picture. You might be thinking, why on earth do we need a study to prove teamwork is important? And that's a fair question. But the reason is, and you might find this hard to believe, the actual scientific evidence was, well, it was a total mess.
I mean, you had some studies saying great teamwork was a game changer for patient care. But then you had others saying it made almost no difference at all. And this kind of contradiction creates a massive problem, right? How can you possibly justify spending tons of time and money on teamwork training if you can't even prove that it works?
So this all boils down to one really fundamental question. Forget our gut feelings for a second. What is the actual measurable impact of teamwork on a patient's health? That's the huge question this whole investigation set out to answer.
Now, to measure something like teamwork, you first have to agree on what it actually is. I mean, it makes sense, right? If you can't define it, you can't measure it. So the researchers had to get really specific. And here's what they landed on. They saw teamwork as a process. It's not about how skilled one individual doctor is or how great one nurse is. Nope. It's all about the interactions between people. That's the key. It's the communication, the coordination, the collaboration. All that stuff that happens in the moment when a team is trying to solve a problem together. Here's a really simple way to think about it. Taskwork is the what? You know, the surgeon actually using the scalpel, the nurse reading the vital signs on the monitor. But teamwork is the how. It's that critical communication and coordination that happens between them while they're doing their individual jobs. It's the how, not just the what.
So the big question is, how did they cut through all that noise and confusion from earlier studies? Well, they used a really powerful scientific tool called a meta-analysis. And that's basically a study of other studies. And when I say they looked at other studies, I mean they cast a massive net. They started by pulling in more than 2,000 different scientific articles, all related to this topic. Then came the hard part. They had to filter all of that down. They went through every single title, abstract, and then the full articles, screening them for quality and relevance. And they were tough. They whittled that giant pool of 2,000 articles all the way down to just the 31 best, most high-quality studies. But here's why that's so cool. By combining those 31 studies, they suddenly had this huge data set. We're talking almost 1,400 different healthcare teams. And with that much information, they finally had the statistical power to find the real signal that was hiding in all that noise. Okay, so after all that digging, all that filtering, what did they find? What was the final verdict? Well, for the first time, they had a clear, data-driven answer. All right, for you data folks out there, the statistical answer is a positive correlation of 0.28. Now, if you're not a statistician, that might not sound like much, but in science, that's actually considered a medium-sized effect. It shows a real, significant connection. Plain and simple, better teamwork means better performance. But what does that number really mean for a patient in a hospital bed?
Let's translate that abstract number into something we can all understand, because this is where it gets really interesting. That little correlation has a massive real-world impact.
Here it is. This is what it all boils down to. A medical team with good teamwork is 2.8 times. That's nearly 3 times more likely to be a high-performing team compared to one with poor teamwork. Now, all of a sudden, that medium-sized effect feels absolutely huge, doesn't it? This isn't just some tiny improvement, it's a total game changer.
But wait, there's more. The researchers didn't just stop there. They decided to dig even deeper. They started asking, okay, are there specific situations where teamwork matters even more? You know, like, is it more critical in a crazy, chaotic ER compared to, say, a calm, scheduled surgery? And they tested everything.
Seriously, they sliced and diced the data in every way you can imagine. They compared big teams to small teams, teams who knew each other well versus strangers, chaotic emergencies versus routine procedures. They even compared scenarios with real patients to ones with simulated patients. They were trying to find out if any of these things made teamwork more or less important.
So after all that testing, where does teamwork matter the most? The answer they found was a complete surprise.
Everywhere. That's it. The positive effect of teamwork was strong across every single condition they tested. It didn't matter if it was a big team or a small one, an emergency or a routine task, a real patient or a simulation. None of it mattered. Good teamwork was a critical factor. Period. Always.
Okay, so let's bring this all home. What's the bottom line here? What are the big takeaways we should get from all this incredible research?
The takeaway is actually pretty simple, but it's powerful. We finally have the hard data to prove that teamwork isn't just some nice-to-have or a feel-good idea. No, it is a critical, fundamental part of the medical process that directly impacts whether patients do well. And because we now know it works everywhere, in every kind of situation, it's not an optional extra anymore. It's a universal, evidence-based strategy for making all of healthcare safer.
And that leaves us with one last, and maybe most important question. The science is now settled. The debate is over. We're past the point of asking if teamwork matters. We know it does. The big question now is, if the data is this clear, how can our healthcare systems make sure that great teamwork isn't a matter of luck, but the standard of care for every single patient every single time?